simple cases that the rest of the world needs to know about you. What you can do, what your patients have benefit from, your years of work and study. It helps your other patients find you, new patients. And it helps fellow dentists solve similar problems. I had Gerald Smith just submitted a case report on how he treated 4 bicuspid extractions without making a federal case of it. All right, the patient had 4 years of back pain after extraction retraction orthodontics. And this helps put biological dentistry more on the map. So I'm going to just show you quickly a case example, and we're going to just parallel the requirements that go with it. Okay, so the first thing you're going to do is going to say, subjectively, what is the patient's presenting complaint? So you document it. I like to document mine. This one came up. Could turn it off? Okay. You can close that now. Okay. Okay. All right. Thank you. So the first thing you do is do case reporting very simple is follow the SOAP format. Subjective, objective, assessment plan, and C is for comments. Why is this case worth commenting? Why is this case worth sharing? And in my position, I have seen a lot of cases that you have done as well worth sharing. The rest of the world needs to know about what our members can accomplish and have been accomplishing. So, summary stands for why is this case worth reporting? Subjective, what are the presenting complaints? Objective, what are your examination findings, assessment, test, imaging, labs, CT, sleep test, material compatibility, plan, treatment by you or others, and or others, okay, and outcome. Then comments. This is where you get to say what's your opinion. In my opinion, the traditional way of doing treating this problem is not as superior as this. So you can stand on your soapbox there. Okay, so you start from the end. What's the summary of your case report? 2 to 5 sentences. You don't have to write a heroic paper. Okay, this is a simple case report. 2 to 5 sentences in 2 minutes. Right? You can dictate it into your smartphone and have your staff type it out. This is not a federal case. It's like you just imagine that you're talking to your fellow dentist, or get on the phone, talk to Felix, and say, okay, how would I describe this case to him? And then the second point is how your treatment improves this patient's oral systemic health. Now, we're not just doing teeth anymore. Biological dentists, we're interested in how to improve overall health from mouth, right? What did you do? And why is this case worth sharing? All right, so you can say, in the case of a 4 bicuspid extraction case, we did minimal expansion with such and such an appliance, and that's it. So, this is the summary of this case that I'm using in parallel with this guide. So, oral appliance helps to open an airway in this anterior open bite case by creating room in the mouth for the tongue. Okay, now the tongue doesn't have to try to fight its way out of Alcatraz. Combination of nutritional, chiropractic, and oral appliance therapy results in increased energy for better sleep, cessation of snoring, teeth grinding, and improved facial appearance, and so on. All right, so that's your summary. So people look at this thing and say, okay, I know what this is about, I will read it. I'm interested in, I got patient with this kind of problem. You now become searchable under some of those keywords. Subjective. What about? You all know this. You know how long have you had this problem? What are they? I like to use 3 wishes to the fairy godmother. If fairy godmother shows up right now and she can wipe away top 3 of your symptoms, what would you like it to go away? What have you done for those symptoms? Traditional root canal, extractions, medication, surgery, and how much do these problems bother you in your life? The pain stopped me. 7 on a scale of 10. 10 means I want to check off this planet. Okay, so subjective in this case, 17-year-old referred by mom's chiropractor, teeth grinding, snoring, braces done at 14, but teeth went back. Okay, and then neck and shoulder pain. Well, at 17, you should be top of the world. You shouldn't be having neck and shoulder pain. What's objective? Objective in this case means dental, orofacial, postural exam. In your case, it may just show a facial appearance wherever the eczema is. Photos, x-rays, models, the standard dentistry stuff that you do in your practice to defend yourself every day. Lab tests, perioral tests, anything you can think of that is relevant to this particular patient's case. In my case, I often use sleep tests, heart rate variability occasionally, blood tests, not too much. Perioral tests I do use a lot. Radiologist report and physician letters. All right, so often they will need to get a radiologist summary from their MRI or CT scan. So I use this graphic version of evidence. You can use just a citation, it's just fine. The more you can illustrate your case, the better. So in this case, we show that this is the patient's pre-treatment head posture, and you cannot see her uvula. Our diagnosis shows that teeth grinding is a reaction to the tongue choking in the throat during sleep. So we document that the maxilla is narrower than the mandible. And we show that we document the treatment. So your photographs, clinical photos are also a form of your documentation and a very powerful and effective one. You do not have to write as many words. You just throw it up on your PowerPoint slide and drop it into your case report. Objective. What are your evaluation findings? Okay, your evaluation findings can include CT and physical evaluation, cephalometric findings, all your clinical exams, perio, charting, restorative charting, your cavitation scanning, EAV testing, whatever you can find and document. Okay? In the case of this young lady, anterior open bite was documented, and we found that she had nasal obstruction. And why is that relevant? The citation is here. Nasal oral airway obstruction, why is that relevant? It's there. Anterior crowding, uvula is not visible with mouth open, flattened cusps. You just say, okay, what's the findings? I don't need to read you the whole thing, but you point out what's obvious. So just briefly, we're doing this. All right, so people can see, and you just highlight the findings in words. It keeps things short. So assessment. What is your diagnosis as a biological dentist? Okay, this is where our perspective comes in handy. What is in this mouth that impacts on your total health in your opinion? Is it amalgam? Is it malocclusion? Is it decreased vertical dimension? Okay. I can't get this thing correct. Okay. What is the logic that you're following? The logic we're following is that the mouth and the body is connected. Okay? Dentists just don't do teeth anymore in our academy. Okay? And references wherever relevant, you cite it. So we'll just put this together and see what it looks like. Sure. All right. So this is another evidence that, if you could see the white part of the sclera between the lower eyelid and the iris, well, it's the evidence that the maxilla is deficient. Okay, so you can cite this and say, okay, this is the basis of my treatment. This is not research well known. This is like pioneer, clinical observation. But this is anatomically correct. Like the maxilla has 3D. When it's deficient in all 3D. So this is deficient in the vertical dimension. So a maxilla that's narrow would also be deficient here.
Yeah, because in Asian literature it used to be sanpaku.
Right. But in the sanpaku is related to maxilla deficiency. That's what they're saying. Yeah. Okay. All right. So what is assessment? Assessment means that what is it that you're gonna treat? Okay. So in this case, we're treating underdeveloped maxilla. We're treating underdeveloped mandible. We're treating mandibular dyskinesia. Dyskinesia means the jaw jiggles and hesitates and wobbles when it opens and closes. That's called mandibular dyskinesia. Cervicalgia, neck pain. All right? Sleep apnea with insomnia. Okay? That's my assessment, and that's what I'll be treating. So I'm documenting that, okay, what is the basis of my treatment with a cephalometric analysis? So in this case, she is majorly retreated here, and she is weak chin, class 2, retreated mandible here. Okay, so that's the main thing I'm treating. I'm looking to advance the jaw in the anterior direction and make room in the mouth for the tongue so it's not locked into the airway. What's your treatment plan and outcome? Okay? Your treatment plan, your systemic support, meaning that I recommend that you always work with some physician, chiropractor, naturopathic physicians like Louisa Williams or equivalent in your community. I know there's no equivalent. Quite well said. But call her up on the phone and say, what do I do? And get her opinion. Yeah, I want to hijack her too. All right, so integrated collaboration, if any. I think the more we can document that, the better, the safer your case is in the eyes of the boards that regulates us. What is the treatment outcome? What's the objective evidence and the before and after comparison? Okay? So this is the plan and the outcome. So you can show progress photos. In your case, you can show before and after amalgam revisions or extraction or radiographs of cavitation surgery healed 9 months, 12 months later when you can show the radiolucency. Okay? But in this case, I just let the picture do the talking for the patients and the parents. Because a lot of the patient public will be searching and looking for these cases eventually. Okay? So you're speaking not only to your professional audience, you're also speaking to the lay public out there. So keep that in mind. So what is the treatment plan? In this case, we had nutritional counseling. She used to be a junk food, fast food eater. Okay, in this case, and that's why she has stuffy nose and snoring. And we talked about why she should eat organic, and there are plenty of references there. We recommended Western Price Foundation diet, and she went to town for it. Okay, sleep hygiene. We told her to use blackout blinds in her bedroom. Cost $80, $90. Most people who were serious about their sleep will spend the money on that. It's available from Home Depot, for example. Oral appliance therapy to redevelop deficient maxilla and mandible. We did not just do this. This is a combination treatment, okay? Integrating oral and systemic. She sleeps with a face mask to forward develop her maxilla. Myofunctional therapy to correct a tongue thrust. And we put in orthodontics. We never really did orthodontics because she was so happy with the outcome. So this happened without braces. And even I was surprised, but you let the picture do the talking. I couldn't predict this. Any more than you can predict that you fix the cavitation and how much the patient is going to improve. You take away the burden, then the body responds, and you observe. Right? So the outcome, so you want to document the outcome of your treatment based on your logic. Okay? So the outcome in this case, no more snoring, no teeth grinding, tons of energy, and winning matches again, and people will be able to see what the radiant facial changes have come over them. So you want to list some objective evidence of treatment success. You don't want this to be just like, okay, I drum my own chest kind of a claim. You want to have objective evidence, and subjectively, patient video always is helpful, but objectively, you want to provide some evidence. So I'm sure every one of you have cases that is worth sharing with the rest of the patient who is suffering similar symptoms. I mean, if we were to take all the symptoms all our patients have, I'm sure we can come up with the top 100. And let the patient public go search that top 100 symptoms. And they'll be able to find you through your case report. Okay? So in this case, we put this out there, and I believe we have one more thing here. This is my comment. My comment in this case, we eliminated sleep apnea episodes. It also eliminated teeth grinding. So that's an important point. You fix the sleep apnea and teeth grinding goes away. Okay? She's a very good patient. She did everything you tell her to do. Okay? Some patients complain they don't get the outcome because they didn't put in the effort. Her progress and result reflection of her relentless pursuit to health. I mean, that has to do with case selection. Don't treat people who's going to put all the burden on you. As a result of her dietary cleanup, her mouth breathing is gone. And that is a decisive factor in being able to achieve this clinical outcome. So just go back and ask your staff. You don't have to think about it and rack your brain. Just ask your staff, what case stands out in your mind that I should report on, that I should share, that we should share with the Academy member? Just one case. Every week you'll find one case. It's just a question of how you're going to take the time to write it. Now it's really even easier. You take out your smartphone and dictate into it. When you're dictating there into your smartphone, just follow the comments. Follow the outline here. All right? If you have any questions, just feel free to ask me. Yeah.
So when a patient has an S-shaped opening, when you're checking on the physical exam, you call that mandibular dyskinesia?
Zigzags, yes. Mandibular, yeah. I just call it sclerovisible.
Sclerovisibility
Yeah.
due to maxillary
Deficiency. Yeah. Hypoplasia, hypoplastic maxilla or underdeveloped maxilla. Yeah. Yeah. All right. So if you're interested, this is one recorded, and two, contact me, and I have a PDF on this. You just won't have the video playing. That's all. But the outline is all there. All right. So with that, I want to thank you for your interest. And Lisa Verrigan or myself are always available if you have any questions on regarding the case that you want to report. Thank you very much.